What is male pattern hair loss? I'm Blake Brooks. I'm a board certified dermatologist and hair specialist, and I see patients in my clinic for this condition many, many times a day. Male pattern hair loss, also known as androgenetic alopecia, is a type of hair loss that's inherited. It's polygenic, meaning multiple genes are involved, and very, very common with the majority of men experiencing it. In fact, by age 70, fewer than 15% of men have no baldness. The onset can be really variable, and you can even start to see it in the late teens, but usually a bit later in life. Although some people may be unaware of when they start to lose hair, as people generally have to lose about 50% of their hair to notice a difference visually. It is hormonally regulated, but you don't have to have sky-high hormone levels to see this happen. In fact, in patients who are genetically susceptible, normal levels of androgens, the hormones that are at play here, are sufficient to make you lose your hair. The hair loss in male pattern hair loss is, as the name suggests, patterned and predictable. So the hair is lost in some locations, but usually retained in others, like for instance, the back of the scalp, where even in people who are totally bald on top, we tend to still see hair. What's happening is that the hairs that are in areas we tend to think of as affected by male pattern hair loss, so like on top, are sensitive to certain hormones, whereas the hairs in the areas we tend to think of as unaffected, so again, the back, are not as sensitive. The hormone that is the really bad player here is something called DHT, or dihydrotestosterone. When susceptible hairs are exposed to DHT, they get finer and finer over time and eventually disappear. If you have male pattern hair loss, you may have noticed that the hairs in the areas where you are losing hair look and feel different, finer, less voluminous. That's because when hair follicles in susceptible areas on the scalp are exposed to DHT, the follicles shrink or miniaturize. And when that happens, the hairs naturally shrink too. And this continues until the hair goes away. This is a really good picture to show kind of what's happening. It's an up close look at the scalp. You can see that there are these hairs here that are really kind of fine and some that are much more thick, much more robust. The fine hairs are the hairs that are starting to undergo what we call miniaturization and will eventually be lost, whereas the more robust hairs are hairs that are not yet affected. You can think of this as a transition of your hairs from the type of hairs that you would normally think of as growing on top of your head, what we call terminal hairs, to the type of hairs that are fine and lightly colored and sometimes referred to as baby hairs, what we call vellus hairs. The other thing that happens to susceptible hairs is that they spend less time in the actively growing part of the hair cycle. The hair goes through a cyclical growth process with defined phases. There's the anagen phase, also known as the growth phase, when the hair is actively growing. Most of the hair on a person's head is in the anagen phase, which lasts years, although the exact length of anagen is person specific. So if you've ever met someone who says they just can't grow their hair very long, they may have a naturally shorter anagen phase. The other phases of the hair cycle include the catagen phase, which is a transitional phase, typically lasting weeks, the telogen phase, the resting phase, which typically lasts months, and the exogen phase, which is the shedding phase. Hairs naturally move through this cycle, which is why losing a certain amount of hair per day, roughly 100 on average, but there is definitely a range, is considered normal, because on any one day, a number of hairs are going to be in that exogen or shedding phase. Once shed, a normal hair cycle will allow the hair to then regrow. In male patterned hair loss, the anagen phase, so the actively growing phase, starts to shorten, meaning that the hair spends less time in the growing phase and therefore cannot grow as long. So sometimes when my patients come in with male pattern hair loss, they'll say their hair seems finer, less voluminous, and they just can't grow it like they used to. The medications we have available to us for male pattern hair loss do a pretty good job of addressing these issues. I'll talk about management of male pattern hair loss in another video, but from a prescription medication perspective, finasteride or Propecia helps to stop the hormonal driver of male pattern hair loss, whereas minoxidil seems to extend the anagen or growth phase of the hair in addition to assisting with hair regrowth. When I talk about male pattern hair loss management with my patients, I'll often describe it as a tug of war. Your genetics is trying to pull you down one path, and we have to put medications and other interventions on the other side of that rope to try to pull you backwards. The amount of force that you need, so over here, to counter your genetics is somewhat variable, but there are a number of things to be done. When it comes to medications, you can think about stopping the medications for male pattern hair loss akin to letting go of the rope in the tug of war. You essentially let genetics pull you down a path where you lose your hair in a patterned way. Having the medications on board for a period of time doesn't mean you'll have a worse outcome, but if you ultimately decide to stop them, it just means that you might notice a starker contrast in how you appear after stopping the medications because you were kind of putting a pin in time, and upon release, your genetics are playing catch up to bring you back down a path you would have ultimately been on anyway. So ultimately, male pattern hair loss is common, but it's still really challenging and it can greatly affect quality of life. There is no reason to go through it alone. There are a lot of things that can be done to manage it. So make sure you see a dermatologist and ideally a hair specialist to help.